Great. We're going to have a seat. Thank you so much to Dr. Boos. I don't think he could have set up this conversation more effectively. In fact, all morning, we've had fantastically and hugely relevant conversations. First from Dr. Agnes Soares de Silva, who talked about the moment we're in right now and the maybe a very good time with all of the NDCs in the process of being developed, a very opportune moment to be having these discussions about formal governance structures, and that's what we're going to kind of jump into here. I loved that Dr. Carvalho had that quote from the United Nations saying it's becoming increasingly unhelpful to deal with development separately from the climate change framework. The Paris Agreement and the SDGs are one and the same, or should be. So thanks for reminding us of that. And then Dr. Boos was right on, and actually is one of the most authoritative voices out there on this concept of integrating biodiversity and health within climate change and other frameworks, and the challenges and opportunities that are there. So that's what we're going to discuss. This is very much a learning session for me. I've been scribbling notes all over the place, and I think I will continue to do so as we talk to our panelists. Oh, good, they're online. So I'm happy to introduce first Matthew Carvalho. Matthew is a Global Health and Climate Fellow at Georgetown University, and his research explores legal coherence and integration across multilateral health and environment frameworks, and how international law, and future leaders can help us get there. So again, thank you for being here, Matthew, perfect person to weigh in on this topic. And then online, we have Cecilia-Njenga, and some of you may remember that Cecilia joined us at last year's Forecasting Healthy Futures Global Summit. She is Director of Intergovernmental Support and Collective Progress at the UNFCCC. So she plays across sectors and is playing a central role in helping countries align their climate commitments with those sustainable development priorities, and actually has that kind of global view on these NDCs as they're coming in, where there are and are not linkages. So Cecilia, thanks so much for joining us again. Liz Willetts on the left up there is an independent consultant and Planetary Health Advisor. Liz served as an advisor to the Convention on Biodiversity for the drafting and development of the plan that Dr. Boos mentioned, the Action Plan on Biodiversity and Health that was resolved last year at COP16. And after publishing Health in the Global Environmental Agenda, a policy guide, she went on to advise the World Health Organization on climate change governance and serve as Planetary Health Policy Director at Harvard. She's also a policy writer for The Lancet. And then finally, Jess Beagley. Thanks for joining us, Jess, on very short notice of the invitation. Jess is the policy lead at the Global Climate and Health Alliance. She works to ensure that health is front and center in climate policy, and she brings deep experience in advocacy and civil society engagement around these global environmental processes, and so she'll be able to share a lot in terms of the opportunity we have between now and Belém. And before we jump right in, that opportunity that we have between now and Belém is real. We've heard invitations from all three representatives of the government of Brazil and the COP30 team to weigh in. And so I want to make sure that all of us understand the significance of the opportunity, take the advantage to have those conversations, and reach out to Forecasting Healthy Futures to help make those connections as well. And we're really looking forward to playing that connecting role if we can. But we've got a lot to tackle in a short period of time, and we're sitting with the expertise, so I want to get right at it. Oh, good, I can see you here. Liz, I'd like to start with you, if that's all right. Considering that you have many years of covering all three Rio conventions. We talked about the Rio Trio, so that's biodiversity, combating desertification, and climate change, and the World Health Assembly. We'd like to hear from you. How do we start? Give us the big picture here. Dr. Boos said, we've got to address governance at all levels, but what's the lay of the land to set the stage for our conversation now? Where do we need to be thinking about those linkages between biodiversity loss, climate change, and human health in policy, in actionable policy? Liz.
Thank you so much, Kelly, and for having me here. Is the sound okay?
We are having some technical difficulties, but at the moment you sound great.
Okay. I'll look for a signal if you need me to stop. So thanks again for having me here. This is such a timely event, and to echo Daniel's comment, we need more spaces like this that allow us to discuss these synergies and to really think across different agreements. And I think there's a key point that underlines our session, which is all multilateral environmental agreements are health determining. Now, what do we do with that and how do we action that? When we think about the Rio Conventions, each of them, if implemented well, will have positive impacts on health. But where are we in the state of engaging on those agreements as a health sector or in an intersected way? There are some differences. We've made some big movements on the climate and health space. Jess and I believe Cecilia are going to speak to that later on. We have a very limited amount of progress on the CBD biodiversity space. I'll go into that in a bit more depth because Daniel did give a great history on where we are. And then in terms of the UNCCD and how we think about land and land governance, desertification, degradation, and drought, we have barely touched the surface. So if we're thinking of the Rio Convention as health determining, we have a lot of work to do. And that work is going to come, as you mentioned, at the global governance level, looking across those agreements, but then also how we implement them and how we engage stakeholders in a diverse way at the national level. So what do we need? Where do we need investment? And I wanted to start with a few points on that to set the stage, and then I'll go a bit more into biodiversity. The first thing that we need in order to encompass this gap is a strong community of practice that's really equipped to think systematically across these regimes, and also that firmly grasps the environmental issues and also can consider health as a broad domain. Daniel mentioned this idea of prevention. We often engage on health in multilateral environmental agreements related to acute issues. Broad domain would mean looking across specialties, looking across health outcomes across the life course, thinking about physical and non-physical aspects of health. This is where we need to build this community of practice to engage in these environmental spaces. One area that's moving forward on this, but has a significant opportunity to do more, is even thinking about the monetary and non-monetary values and also market and non-market and intrinsic values of the environment for health. Where else do we need investment? We really need to understand global environmental governance from the health perspective. And we need to develop that for professionals. We also need inter-professional development. So for example, engaging the community of medicine and the community of law in spaces where there can be shared learning and co-development of knowledge and tools. We also need institutions to develop roles for professionals to engage on these new skill sets and really strategizing roles that enable professionals to strategize the planetary boundaries comprehensively and not in siloed mini health silos. And we also need good investment on the human right to environment and how we're going to achieve that. How do we operationalize the human right to environment? And that has a tremendous connection to health. Human right to environment is going to be a tool to achieve public health outcomes. So in my work, I've spent 16 years tracking multilateral environmental agreements, including the Rio Conventions, 7 years in clinical practice. And last year, I was engaged in the triple COP year across the Rio conventions. I also followed the World Health Assembly for the last few years and this year. And what do I see in 2025? In 2025, the Rio conventions have, as our colleague from Fiocruz was mentioning, a very prominent narrative on synergies. And how do we capitalize on this? And this synergies conversation makes sense. It is efficient, it is cohesive, and many governments are asking for this, especially in resource-limited settings. How do we think across not only the systems and outputs, but also in terms of risk? Where are there shared risks, and how do we create shared solutions? And this is what the health sector needs to pick up on, is this synergies conversation that is already warming up across the UN system. A few more points related to biodiversity. So yes, I played a role in the CBD last year. Daniel has been involved in this work for decades. There have been building blocks built by PAHO and other institutions, and even under the CBD for a long time. And now we have a global action plan on biodiversity and health that is a true milestone in the governance of environment and health. We need to really think about how to use that and to amplify the tool now that it has been achieved. We really have a key opportunity to do this, and because environmental agreements are built in environmental forums and largely include environmental stakeholders, we are going to have to translate them into health objectives and see how we can use tools like the Global Action Plan on Biodiversity and Health as a tool to address planetary boundaries and planetary health in a cohesive and systematic way. Briefly, the action plan, it's about 30 pages. It has two main sections that have 91 actions across them. The first section is the architecture for systemic change, for coordination across governments, discipline sectors, and stakeholders. The second part is a health map for the global biodiversity framework. There are health actions outlined and agreed and adopted by governments for 23 GBF targets. And this includes across land, marine, food systems, and for climate change. The Global Action Plan is inclusive, draws on many other multilateral environmental agreements, bodies of knowledge. It outlines science from the IPCC, science from IPBES. And at this moment, again, to pick up on Daniel's comment, the focus under the CBD on this action plan is how do we develop indicators that can monitor it? And there's a real conversation about how do we think about the environmental burden of disease? How do we track that? And in the broader conversation, again, how do we avoid the mini silos that indicators can create? We need a health metrics that's not only going to encompass such a broad plan, but something that, as Daniel was saying, really insightfully might work across the different Rio conventions. If I had a couple more minutes, I could go into the details on the climate, biodiversity, and health interlinkages. But I'll just close this section about what do we need to mobilize this plan is we really need to start thinking about it across the different Rio conventions. How can health-related agencies pick up this plan? Many departments of the WHO, the UNICEF, UN Women, how can it be employed in their work, invoked in other decisions, or thought about in terms of co-benefits and capacity building? And again, the Global Action Plan supports the other Rio conventions. It supports food systems governance and could be invoked in forthcoming decisions across those bases. So I can stop there or follow up with some detailed points.
Liz, we'll come back to you for those detailed points. Thank you so much. But I think that's a perfect sort of segue as we move. Cecilia, I want to look to you. So Liz has described an opportunity and a need. The global health community really needs to understand the significance of the moment, the significance of how the Global Action Plan on Biodiversity and Health can and should be a unifying factor for the health community to lean into that, to work toward integration. And you also touched on the need or opportunity for health metrics that can span across multiple conventions and disciplines and sectors, and I'm excited to come back to that. And we actually have a really good session coming up after hours that's looking at exactly that. But Cecilia, you sit at the UNFCCC, and in our conversations about the Rio Trio, you mentioned that you had seen some of that integration happening at the very highest level of the executive secretary level. So conversations happening between Simon and between the heads of the three separate frameworks. But that's a different thing than actually integrating in policy and practice. And you're also seeing, for example, the NDCs, you're looking at adaptation plans from countries all the time within the UNFCCC. So I guess, to what extent is that integration already happening at that national level in policy? What are the barriers, and how do we move forward from here?
Thank you. No, thanks very much, Kelly. Indeed, and it's great. I'm following up from Liz and also Daniel's initial remarks. And it's a great pleasure to join you. The Rio Trio initiative, launched last year by the 3 COP presidencies of the Rio Conventions, has indeed marked a very, very promising step forward. And what we are seeing is that the increasing collaboration among not just the presidents of the executives you just mentioned, the UNFCCC, CBD, and UNCCD, is a signal to the global community, that actually this thing, what you were saying, is indeed true. So it's one thing to be politically connected at that decision-making level, but I think it's where the response is required that we need to start seeing more concerted, response. Simon Steele, our executive secretary, said at COP29 that climate change, desertification, the loss of biodiversity, these are different. They are different in nature, but they are all facets of the same crisis. And I think that's important. Daniel earlier here had just mentioned that these conventions were born out of the same summit. And I was one of the proud youths to have been in Rio in 1992 when these conventions were born. And for me, being at the seat here in UNFCCC, last year, it was really encouraging to see the 3 COPs meeting happening at the same time, the COPs happening at the same time, but also more encouraging to see them beginning to move back to alignment. So while the coordination at the global level is advancing, the gap remains in translating this alignment into real operational change at the national level. At intergovernmental and at technical processes, we are seeing more conversations across the 3 Rio conventions, but it's still very at its infancy. In the national context, the ministries of health, the ministries of environment, the ministries of agriculture, the ministries of finance often work independently. And I've been supporting countries at the country level for 10 years before moving to this position. And I know that I've been supporting countries to come up with national environmental plans, biodiversity plans, whether it's under NBSAPs, etc. And I have proved that climate policies are typically led by one ministry. A lot of times, biodiversity action on the other side is led by another, and health strategies are led yet by another, and each with separate data systems. Funding channels are also separate, and the planning cycles are also separate. And this fragmented landscape is really where the challenge is, and why we cannot be able to benefit or have the core benefits of these synergies, and we continue to miss this at national level. So while it's a shift in our countries, structure national processes, whether it's by the NDCs, whether it's by the NAPs or NBSAPs, it's important that rather than treat health, climate, biodiversity, and land as standalone issues, we must embed integration from the outset. And here again, the SDGs offer us that framework for integration. But how well are we leveraging from this? And how best can we, from the other frameworks and mechanisms that are offered, whether by NAPs, NDCs, and NBSAPs, be able to leverage from that. So aligning the NDCs now, we have an opportunity. Only 20 NDCs have been submitted to date. We still have more than 170 to come through. So there is an opportunity here to align these NDCs with Agenda 2030, to align them with SDGs, and be able to have a strategy that leverages the core benefits. And I would like to share very quickly 2 examples. In countries like Colombia or Burkina Faso, we have seen an alignment of the climate strategies with health and biodiversity priorities. And there is a recognition of the interconnected nature of these agendas. They are integrating across sectors and leveraging existing strategies, and I said the SDGs, but also the One Health approach to help guide processes at national level. So initiatives such as these help us see that we can build climate resilience while also improving public health and economic outcomes. But many countries, and I will say from experience, lack the technical and the financial capacity for this type of integrated planning. So translating coordination into impact, I'd like to highlight, will take 3 things. First, technical support, sustained finance, and thirdly, capacity building at the local level. But I have some good news also, Kelly. And the good news is that the mechanisms do exist to support this kind of alignment. For example, we have the NDC partnership, and we also have the climate finance mechanism, such as the Green Climate Fund, where cross-cutting proposals could be prioritized, could be delivered jointly, and benefits would be accrued across all the conventions. So they are entry points. And what is needed now is just the political will, the institutional capacity, and the right incentives to make joint planning and the norm rather than having it, as it is the exception. And so last year, we saw a high momentum. And also I was actually saying 2023 in Dubai with the UNFCCC. And critical COPs of biodiversity, the climate and land are taking place in also continuing to convey not only the urgency of action, but also the opportunities to raise the ambition, to increase the investments, and also collaborate, that the collaboration and the level of collaboration that's needed to respond to the changes as we prepare for Belém. I think there is a commitment, even by the COP presidency, incoming COP presidency, to build on this momentum. And therefore, the conversation at the COP should underscore that we cannot continue tackling these challenges in isolation, that climate change is not just about carbon emissions, biodiversity loss, and is not about endangered species and land degradation, but it's also about health. And I like what Liz said, physical and non-physical health. And they are parts of a much larger, more complex global puzzle. And if we are to solve this puzzle, we need coordination across all fronts, from national governments to international mechanisms. Thank you very much, Kelly.
Thank you, Cecilia. You just really brought a lot of different concepts together, and that's really helpful. I'm conscious that we're not going to have time to do this topic justice, so I just want to remind everybody once again that in the Summit app, there's a discussion platform. Let's get some dialogue going there, because I'm not sure we'll have time for questions now, but our panelists are on that app, so you can send them questions directly. We can start a conversation there, because what you've just said, Cecilia, is perfect as we turn to Jess. You're describing this moment where everything makes sense, as we've heard over and over today. It makes sense to unite across these disciplines and frameworks. We're also at a moment of plasticity with the upcoming COP30, a very open and inclusive COP30 presidency. Frameworks already exist to do this. And And countries are working on their NDCs. And Cecilia, thanks for giving us the example of Burkina Faso. We also heard Panama put forth as an example of a country that has effectively integrated health and biodiversity across their adaptation plans. So that's really exciting. It can be done. So Jess, in your role with the Global Climate and Health Alliance, you're talking all the time to stakeholders in this space, mostly in the global health community, global health and climate community. You're working to help them prepare for this opportunity that is COP30 in Belém. What have you heard today that informs the way you will empower your membership at GCHA to be effective and to make change in these very critical upcoming few months?
Thank you so much, Kelly, and thank you to the wonderful panelists that have gone before me. Thank you, Daniel. Thank you, Liz. Thank you, Cecilia. I'm really looking forward to hearing from Matthew as well. And I think it's so clear from what has been said today that we can't have positive outcomes on health without action across sectors, and that is why the health community needs to engage in climate decision-making spaces, whether at COP or at regional and local levels. We won't address health without actions in agriculture, in energy, in water, in sanitation, transport, urban planning. We can't have healthy populations unless we've got nutritious food, clean air, safe water, active travel, and protective living environments. And Daniel made the point about balancing prevention and response, and we can't have one without the other, but we need to make sure that we are reducing emissions, particularly in the most high-emitting countries. Otherwise, we risk exceeding the limits of adaptation in the healthcare sector and in other health-determining sectors. At the same time, we can't have positive outcomes on climate without action in the healthcare sector. Both in terms of adaptation, but also in terms of emissions reductions. We know that the healthcare sector is responsible for about 5% globally on average around the world. At the same time, healthier populations are much more likely to be able to withstand and recover from climate shocks, and they can support economic stability and longer-term growth. So with the climate and health community, we're really working to make sure that these connections are reflected in policies that are made under the World Health Assembly and under the UNFCCC, including at COP30. And I'll just reflect briefly on what we've seen happen that we think is positive and what is left to do. So there is a resolution that's been recently updated under the World Health Assembly on climate and health, and that refers not just to actions that healthcare ministries can take in and of themselves, but also refers to health in nationally determined contributions. In the Global Plan of Action for this resolution, health and climate is also the first priority in WHO strategic plan from 2025 to 2028. That's the general program of work. And that general program of work also refers to UNFCCC instruments, talks about the loss and damage fund, and it talks about the global stocktake. In COP processes, we're familiar with the fantastic COP26 health commitments. We know that there's a declaration, there's been a health day, there's been a ministerial, we've seen finance principles, we've got a Baku COP to COP presidencies continuity coalition. Things are really moving. And as I gather everyone has heard this morning, there is going to be a dedicated health plan, thanks to the Brazilian presidency. And again, in the declaration, it talks about the importance of health in nationally determined contributions, but also reviewing progress at future COPs and at future World Health Assemblies on climate and health. So we've got all this momentum, we've got fantastic rhetoric, we're getting stronger and stronger on governments, but it's not translating an action that moves from rhetoric to realities, an action that delivers for what people's lived experiences around the world. I couldn't fit it down to 5 asks, so I've got 6 priorities for what I think we need to do to bridge that gap and where the climate and health community can be turning its attention. We know that these international policy-making spaces can be incredibly opaque, they can be incredibly hard to access physically, financially, and just because of the jargon that is used in some of them. So we really need to make sure that those of us that do have access to those spaces work increasingly closely with communities to understand what is needed, but also that when policies are made at national level, that when these top-down policies trickle down, that those decisions are made with core participation and co-development principles, both in planning and implementation. we've got the declaration in the UNFCCC space, but that does sit outside of the negotiation process, and we need to think much more carefully about how health links to different UNFCCC negotiating streams to make that there is more concrete follow-up that goes on inside the formal UNFCCC process. And when we're doing that, we need to be really conscious of what decisions are under the purview of people that go to the COPs and what decisions are under the purview of the leaders that go to World Health Assemblies. We need to use both of these spaces, but we also need to understand what they are both good for and continue to be really responsive to and mindful of that. So ministries of health that go to the World Health Assembly can and must work with agriculture, energy, transportation, and urban ministers, but they can't make their own agricultural, energy, or transport policy. Equally, a Minister of Climate, Environment, or Energy at COPs can develop a just transition plan, but it's not within their remit to develop a plan to strengthen the healthcare workforce. These are different people, and we need to make sure that the asks that we're making under both of these processes are tailored to the people that hold the power and the decision making in them. Once we get these global agreements, we need cross-ministerial coordination at national level. We know that there are countries that are really excelling in coordinating between their health and climate ministries. This isn't something that we see nearly at the scale that is needed. So NDCs are part of that, but we also need climate in health decision-making processes, and we need more sustainable cross-sectoral coordination mechanisms at national level. I'm on to my fourth point now on understanding what to do, but less about how to do it. And I think attached, the Alliance for Transformative Action on Climate Change and Health is one really core component of this. We need indicators and accountability. We've heard a little bit about indicators and what might make a good indicator or a less good indicator. We need better evidence and data, but we can't wait for the perfect evidence and data. But one key thing to think of within the UNFCCC process is the development of BTRs, another friendly acronym for all of us, but BTRs are biannual transparency reports, and they are reports on what's been done to implement NDCs, so we can be looking out for health indicators in those biannual transparency reports. Equally, there are going to be climate-related indicators in WHO's general programme of work. And finally, and the thing that is very much at the forefront of anybody's mind at any given moment, but especially in the current global context, is making sure that there is money, but money in the right places, and tracking how that money is working. The $1 billion US that we saw announced for climate and health at COP28 is fantastic, but we need reporting on where that money is going and how it's making a difference, and reassurance that it is actually reaching the communities that need it. That was my 6. I know we're short on time, so I will stop there, but thank you so much for the chance to join you today.
Thank you so much for being here, Jess, and thanks for those comments, and thanks for making it kind of real and bottom up. So we've kind of been talking about it top down from a global intergovernment governance structure perspective, and even through at the national level through the NVCs, but just what you've really helped do is sort of, what does that mean at the country level in terms of empowering the workforce, empowering the actual experts on the ground, to empowering them with more knowledge about environmental determinants of health and empowering them to be part of that process. And you also pointed out, and I'm going to take a little bit of chair's prerogative here and go over time a little minute, because Matthew, you've come all the way from Washington, D.C., and I'm going to give you more than a minute to reflect on these things. But what struck me is that we have seen a lot of progress within the UNFCCC from the global health community. We did have Health Day at COP28. We do now have the Baku COP Presidency's Continuity Coalition on Climate and Health. We've heard from the COP30 team there will be a health agenda. We're moving in the right direction, but we are still leagues from having a formal resolved health mechanism within the UNFCCC framework. So what I'm hearing from all of you is, how do we make the most of the one that does exist in the Global Action Plan for Biodiversity and Health in UNCBD. This year, we're back in Brazil. I love how Dr. Boost talked about it as these birds that flew out and came back here to really see this integration happen. But Matthew, you study these global treaties, international laws, these frameworks. What do you and your your team of scholars, how do you think about these things, about the reality of sort of aligning and uniting framework conventions and mechanisms at the international law perspective? Talk to us a little bit about that.
Thank you so much, Kelly, and thank you for the invitation to be here. I'm so glad I got to join you in person as well. It's really fascinating because I may have a degree in global health, but I'm an international law researcher by nature. And so the way that I look at integrating health into a lot of these UN conventions and multilateral treaties is really trying to leverage the inflection points across them to bring about these health impacts in the long term. And I'm really delighted to kind of be at the center of this partnership between Georgetown University and Sunway University in Kuala Lumpur, Malaysia. I'd like to send warm regards on behalf of Dr. Jamila Mahmood, steering committee member for the summit. And I also want to thank my colleagues from Fiocruz here, as well as Professor Guto Galvao of Georgetown University, has been a close advisor and friend for quite some time. And through this partnership, what we've been trying to do is figure out what governance for planetary health really looks like. As many of my colleagues online were saying, we have so many of these mechanisms that are very siloed in the way that they govern. They may have a specific mandate or a specific priority, and what my team is trying to do is figure out where are those cross-cutting themes, where are those points, and how do we move them forward. And I think COP16 in particular in Cali was very poignant for me in some of this research. I had the pleasure of being on the ground in Colombia, in particular following some of the negotiations on access and benefit sharing mechanisms of genetic resources. You may have seen in the headlines the launch of the Cali Fund in particular, which was one of the prominent successes along with the Global Action Plan on Biodiversity and Health. But one thing that was really fascinating is if you looked around the pavilion, there were all of these different negotiating tracks happening. So we had the biodiversity and health negotiating track. We had the biodiversity and climate change negotiating track. We had the data governance, this digital sequencing information governance track. We also had a marine and coastal biodiversity decision track. And many of the stakeholders that may have been in those different rooms maybe did not migrate out of them as much as you would anticipate. And it expanded even further. If you wanted to talk migratory species and biodiversity, for example, the Convention on Migratory Species was on the ground in Colombia. If you wanted to talk trade of endangered species and international wildlife, the Convention on International Trade of Endangered Species had its own booth at the COP. So it was really fascinating to see how all of these different conventions touch on biodiversity in particular ways. And my team has worked to develop research and jurisprudence on how to build that legal theory of targeting these inflection points of public international law and leveraging them for planetary health. And I just want to give one example of this that I think is really prominent, if I may. One thing within the international law community that has been really significant over the last few years is a group of small island states have gotten together and asked the international courts and international tribunals to actually interpret climate change obligations across public international law. This started with the United Nations Convention on the Law of the Sea, in particular in relation to ocean acidification and sea level rise, and they requested what's called an advisory opinion, where the International Tribunal for the Law of the Sea, which is the main court for the Law of the Sea, can interpret climate change obligations under the convention, in particular in relation to countries' obligations to curb greenhouse gas emissions. And this was really prudent because the United Nations Convention on the Law of the Sea was adopted in 1982. 10 years before, we saw the Rio Earth Summit and everything that came of the climate conventions. And one of the prominent components of the advisory opinion that was determined, it's non-binding but very persuasive in its language back in May 2024, is it said that greenhouse gas emissions and the obligations of countries to curb greenhouse gas emissions do not just exist under the climate change regime. Greenhouse gas emissions and the obligations of countries to curb them are not just under the Paris Agreement and the international environmental multilateral regime that we might be used to, they also exist under the UN Convention on the Law of the Sea. And this is really, really powerful because this was one of the first moments where we've seen an adjudicating body, an international tribunal say, climate change exists beyond just the UNFCCC, the Paris Agreement. It exists across the entirety of the multilateral spectrum. And now we have the International Court of Justice doing a similar advisory opinion requested by the country of Vanuatu to streamline this across human rights treaties, across the entirety of the public international law sphere. And this is going to be really significant for COP30 in particular. Brazil was one of the countries that actually submitted a statement to the International Tribunal for the Law of the Sea during these hearings and these proceedings. And Brazil actually affirmed this idea that climate change obligations and obligations to curb greenhouse gas emissions are enforceable under customary international law, which means that it's not just the United Nations Framework Convention on Climate Change. There are climate obligations under marine biodiversity and all of these different conventions that we see. So I think COP30 really has a moment, in particular the COP30 presidency, Brazil has a moment to say, what are climate change obligations across the UN system? As our colleagues were saying, if we're going to connect COP30 further with the SDGs moving forward, how do we make sure climate change is streamlined across all of these agreements, and how do we do it in a strategic and tactical manner to ensure that we're fighting against those interests that may not want to see that may want to take advantage of that forum shopping to maybe diminish or dilute these obligations. I think it's a really powerful moment to have these discussions, both at the intersessional meetings that will happen in Bonn, Germany in June, as well as the COP itself. And so my team is really excited to be able to move that forward and see how we can determine ways to streamline these climate change obligations across international law and build these synergies as we're discussing.
Thanks, Matthew. That's really fascinating. And I think if nothing else, it gives us a sense of, so there's a scenario where it's international court and law that unites the frameworks, but an alternative is that it's health outcomes that do that in the same way, and maybe that's the opportunity for us. We have to wrap, we're way over, but I want to work backward and give Jess, Cecilia, and Liz the opportunity to give us a one-line priority. So Jess, if you're still with, good. Jess, you start. You're talking to 300 interested and engaged professionals from philanthropy, from governments and ministries of health and ministries of environment, from NGOs, from the private corporate sector, and representing more than 200 organizations throughout 45 countries. You know, what's the one thing you want them to leave with as something that they can do, an actionable way to help make health the unifying concept and hopefully a quantitative one between at least the Rio Trio conventions and really ultimately at the heart of everything that we can do? Jess, what's the one takeaway you'd like our summit participants to think about?
I would ask for participants, if they're going to COP, to think about one negotiating track and how health can contribute to a more ambitious outcome or a healthier outcome from that negotiation track, so that we're moving health beyond declarations, which are so crucial, but into the negotiating tracks as well.
Great. So engaging with COP30, check in with the Global Climate and Health Alliance. They're so helpful in terms of prepping you for COP and helping to understand how you and your team can be impactful. And so moving health into the negotiating space through the Global Goal on Adaptation and other mechanisms. Great. Fantastic. Cecilia, how about you?
From my end, as I said, we have more than 170 NDCs that are still to be submitted, and therefore this is a real opportunity to ensure that the updates reflect an integration across all the three areas, climate, biodiversity, and health, and that they maximize the core benefits and advance the goals of the Rio Convention. That's really my hope, that by the time we're getting to COP, the 170 NDCs that are yet to be submitted will come in and they'll show this level, heightened level of ambition of interoperability. Thank you.
That's perfectly complementary. So we have this grassroots civil society organization ability to influence health on the COP30 agenda from Jess, saying like weigh in on those negotiating issues. Cecilia, you're saying at the national policy level, practically speaking, make sure that your country is including health and environment in the design of their nationally determined contributions and adaptation plans. Do what you can at that national policy level to ensure that's happening. And Liz, I want to give you the last word. What's the one thing that summit participants can actually do to move this agenda forward?
Thanks, Kelly. The one thing I would say is, as we build capacity, it is crucial that health advocacy and health solutions that are aimed to fulfill or advance one environmental agreement do not undermine other environmental agreements. And this is critical that as we aim at the climate and health space, that the climate and health community understands, for example, the CBD and the UNFCCC, and that the climate and health advocacy is not undermining already agreed or hotly contested debatable areas on a range of biodiversity and environmental issues and land governance. And we're seeing that worldwide, especially when social and environmental safeguards are not taken into account. So that's a really critical issue.
Thank you so much, Liz. And we have afternoon sessions on advocacy, so we'll keep that in mind then. I mean, really, this whole global summit, Sustainable Ecosystems for Health, was teed up for just what you said, Liz, to make sure that we're aligned, and at the very least, we're not in our advocacy or in our actions undermining the efforts of environmental determinants of health and shooting ourselves in the foot, essentially. So let's make sure that there's that alignment going into those discussions. I'm really looking forward to the rest of today. Thank you so much to the panelists, and I'm sorry that we went a little bit over, and I hope I haven't disrupted the schedule too much, but we'll get back on track. So thanks to everybody participating online, and Liz, Cecilia, Jess, Matthew, I certainly hope you will stay for the rest of today so you can, help weigh in on the topics this afternoon that will be directly relevant on metrics and on advocacy. So thanks so much. Let's thank our panelists here.